I remember speaking, I guess, with Dr. Joe, who joins us, every Tuesday afternoon, talking about obesity and the fact that we were trying to make sense of why perhaps this happens in some parts of the world, but not in others. We talked about that a week ago, and then boom, a study out this week that shows that about fully one third of Canadians have become obese, according to this study, with more weight gain happening during the pandemic, which maybe doesn't come as a big surprise. But we have seen a sharp increase, and the problem, of course, with that, as noted in the study, is once you see the increase, it's hard to see it going the other way, at least not quickly anyway. So we thought we'd take a little bit of a deeper dive into this. Dr. Kabiri Dasgupta is a professor in the Department of Medicine, a physician at the MUHC, and on the line. Doctor, thanks for being here this afternoon. I wonder, when you see a report like this come out and you see that number, we're almost a third are considered obese. What was your reaction to this?
Well, unfortunately, I think, my reaction was, thought it was going that way. I think like many, many other people. So, a study like this is really good because it puts numbers and evidence behind what we suspect is happening. And for sure, the numbers of people with extra weight are increasing, have been increasing for quite a while, but they did find a steeper increase during the pandemic, for sure.
Now, I wonder, too, because I know this study, which I think went over a number of years, but kind of concluded in 2023, and obviously a lot of what's happened over the past couple of years is the introduction of all these weight loss drugs like Ozempic and Wegovy. How do we measure those in terms of this? Because I'm wondering, you can go on a drug like this and lose weight, but then once you go off the drug, if you ever do, you just put it back, don't you?
Well, those are really good questions. I think the study is using data before kind of the full Ozempic sort of uptake happened in full swing. And right now in Canada, we only use those drugs if you have type 2 diabetes already or another complication of obesity. Mm-hmm. So I don't think those drugs had a big impact on the numbers that you're seeing. But what they basically showed was that, the proportion of people who were in that obesity category was already increasing before the pandemic, but it increased much more thereafter. Now, your question about those medications, these medications are one tool in the toolkit to confront extra weight, which we all face, but a real underpinning is, how do we deal with an environment where we can order food, where we feel time pressure to prepare meals, where we might be spending most of our day sitting in front of a computer and we're just not moving as much as we could. So how do we structure society to make it easier? Because really, are we all going to wind up on Ozempic and other drugs? Or, what are we going to do? 1/3 is a big number, right?
By the way, as I see the breakdown here, it says more women and young people became obese, which comes as a bit of a surprise, I think, does it not?
What they found was that the rise was more in women and in younger people in general. Often during the pandemic, younger people were at home. They couldn't go to university. They couldn't go to school. Their mood was affected. Their socialization was affected. So it doesn't fully surprise me that younger people were disproportionately affected. And women, we do know that a lot of the child rearing and teaching responsibilities, which nowadays disproportionately impact women, they were that much more when the schools were closed. So I can think of a million reasons why there might have been less attention to activity, health, and maybe kind of mood-related eating. So a real challenge. And of course, the problem is once you put weight on, it's hard to take it off. And so that those extra kilos during the pandemic are probably still there.
So, we look at a problem like this. As I said, we talked about this a couple of weeks ago, trying to understand why there were differences, right? People in North America, for example, tending to be more overweight, if you will, before I get to the obese part, than in other parts of the world. But that's a different story. Well, you see a study like this come out, and it's a Canadian Medical Association, and you wonder, so going forward, based on this, and it's obviously not something we want to get worse, what do we do to sort of deal with this?
Well, I think there's a whole bunch of things. One is at sort of the policy level, and then another is at the program level. So, we actually ourselves published a study in CMAG a couple of weeks ago calling on our governments to think about implementing diabetes prevention programs that involve counseling like they do in England, 16 hours of counseling for people with prediabetes. But in England, they also have those programs for people with obesity. And so I think we really need to start thinking about publicly funded programs that help counsel and support people, not just physician services, but support from dietitians, psychologists, and other trained technicians and professionals. And then we have to really try to make more room and more space for outdoor play for kids and not marketing, having some restrictions around marketing of those delicious but energy-dense foods. We really have to brainstorm together to kind of restructure things because the technologies and the convenience are increasing that number, and drugs alone won't do it.
You mentioned Britain, for example. Is there a willingness here? I mean, the government willing to perhaps listen to these kinds of things in Canada? What sort of indication do you have?
Well, what we're trying to do, in a whole series of studies that we're doing is we're trying to show that it would be cost effective here in Canada, just like it is in England, that we have the capacity to do this, and that we have to start really getting on it. Because if it saves lives, saves money, what's not to like? It's just that we have to get ourselves organized to do these things.
The one last question I have, and when I first saw this, and it's kind of a shocking figure to see when you see a third of Canadians, but we don't talk much anymore about the pandemic. That's in the rear view mirror. And I know you just said, and I kind of echo that, the idea that, once you put this weight on, it's not that easy, of course, to get it off. But post-pandemic now, with that behind us, that's in the rearview mirror. Are you at least confident that that begins to change?
Post-pandemic, even if it were to go back to the similar rates as before the pandemic, that weight that we gained is there until we take bigger action, right? So we all see that. If we gain weight during the holidays and then we go back to our normal eating, we don't gain more, but we may not take it off.
Right.
So we have to really push it and adjust and watch what we're eating, and possibly eat less than we normally do and move more just to make up for that difference. So I think, we unfortunately will have to engage in sort of self-monitoring of our physical activity, of our weight, of our fruit and vegetable intake, all of that, but we have to support one another to do it. And if we don't, as we get older, we all do gain weight, and we all sort of engage in the good fight. And it just seems like younger and younger we have to do this and grapple with an environment that's pulling in the opposite direction.
All right. We will leave it at that. That's kind of gloomy, I think, to be saying that, but that's the reality. So I guess we have to. Doctor, I thank you so much for your time. Appreciate it today. Thanks again.
Thanks, Aaron.
Dr. Kabiri Dasgupta over at McGill. That's a pretty staggering number to read, isn't it? Canadians, we tend to look south of the border when we think about that, right? But it's happening in our own backyard. Obesity rates increasing. When's it going to change? Is it going to change? And are we going to make those sacrifices in terms of food? I think back to that discussion with Dr. Joe, right? Talk about eating habits being so different here than they are in other parts of the world. Here there are people that you just graze all day, a little bit here, a little bit there. Other parts of the world, no one does that. And their obesity rates are much, much lower than ours.